My name is Jessica Bodie, and I am a junior at North Carolina State University. My project, titled Gamma Aminobutyric Acid Mutations as a Possible Cause for Anorexia Nervosa, focuses on genetic factors that may influence anorexia nervosa. I decided on this topic because my cousin has been suffering from anorexia for years, and I have seen the toll it has taken on her physically, mentally, and emotionally. She explained the beginnings of her eating disorder as, "I really just wanted to lose a little bit of weight and be skinny like everybody else was, or how I thought everybody else was. Society placed such a high value on being thin, and that's what I wanted to be. I gradually started to eat less and less so that I could achieve that look." As an athlete, my cousin Meredith knew the importance of fueling her body for her workouts. Even during her soccer seasons, she said she found herself telling herself that she needed to eat more because she knew she had a big game or a practice coming up, but sometimes couldn't bring herself to do so. She knew it would make her play better and have more energy to play soccer if she ate beforehand, but also knew that if she ate, she would think about trying to burn off those calories that she had consumed the entire time. It was a vicious cycle that she was in, and she started to notice that she wasn't as energized when she ate less. It was harder for her to get through practice because of how fatigued she was. One time, during a specific practice her senior year of high school, she passed out because she had not eaten all day. Being a soccer player, she ran a lot during practice, and many of them took place outside in the heat, and her body just could not take it anymore. She fell right onto the field, and that's when she realized she needed to change. Her lifestyle of not eating and being an athlete and having physically demanding practices was not sustainable at all, and her body just gave up. Treatment options for anorexia can vary from patient to patient and target both weight and psychological factors associated. Yet, there is no definitive cure for anorexia nervosa. Anorexia can affect people of all genders, races, and ages, but is most common in adolescent and young adult women. In fact, about 1% of American women will develop anorexia nervosa in their lifetime. Many patients also struggle with the disease for years after they begin treatment. Patients may experience starvation from eating only small amounts, and side effects of this starvation may include weakness, dizziness, hair loss, drops in blood pressure, and for some women, a stop of menstruation. Often, patients can regain weight during treatment but have high rates of relapse afterward. In fact, almost half of patients that are successful in gaining weight in an inpatient treatment facility often relapse within 1 year of being discharged. This high rate of relapse and lack of long-term success is why anorexia nervosa is considered incurable. This disease is mentally and physically debilitating. People who suffer from anorexia may also experience anxiety and depression. Statistics show that about 1 in 5 deaths of people diagnosed with anorexia is by suicide. Common treatments for anorexia are prescription antidepressants, various forms of therapy, and inpatient and outpatient treatment programs. Results of studies researching the effect of different medications and therapies have shown conflicting results, meaning not every treatment option will work for every patient. Funding for my research would greatly help efforts to find a cure for anorexia. My cousin Meredith discussed her treatment history as mixed with therapy and medications. She explained, "My therapist worked closely with women like me suffering from anorexia and helped me cope with a lot of the anxieties I had towards food and my body in general. I also began to take anxiety medications prescribed by my doctor in conjunction with my therapist to help with my general anxiety. This was not supposed to specifically target weight, but it did help the anxious thoughts I had about food, calories, and weight subside as I learned to cope with them." The photo shown here is an image of an adolescent boy suffering from anorexia nervosa admitted to an inpatient treatment facility in Al Zahra Hospital in Dubai. As you can see, he is incredibly thin and seems to have some degree of hair loss. This is because his body was not getting the nutrients it needed to function. Advancements in research on gamma aminobutyric acid, also known as GABA mutations, may provide insight into new treatment options for anorexia nervosa. It is believed that the cause of anorexia may lie within the hypothalamus, the behavioral control center in the brain that regulates food intake and energy expenditure. In patients with anorexia nervosa, the hypothalamus may be improperly assessing nutritional needs and hunger. The hypothalamus regulates hormone secretion and maintains homeostatic levels of chemicals, including the neurotransmitter GABA. In one study, Patients with anorexia nervosa exhibited lower activity of the arcuate nucleus in the hypothalamus, where the neurotransmitter GABA performs its main functions due to low body mass index. In addition, GABA signaling in the hypothalamic neurons in mice was shown to influence the regulation of feeding and metabolism. GABA protein products have also been found to aid in the regulation of anxiety, a common comorbidity of anorexia nervosa. Irregularities in these functions in anorexia patients may be due to a mutation in the gene that encodes GABA. One study even identified a common single nucleotide polymorphism in women diagnosed with anorexia at R17536211 in the GABA RG1 gene on chromosome 4, which codes for the alpha subunit of the GABA receptor. The proposal for the treatment of anorexia nervosa is with goloxanolone, also known as GR3027. This is currently not an available medication as it is still under review, but I think that it has the potential to help treat anorexia. This drug initially was created to treat hypersomnia and hepatic encephalopathy. Goloxanolone is a novel molecule that has been shown to reverse the effects of overstimulation or desensitization of the GABA alpha subunit receptors. In a 2014 study, female rats showed desensitization of the alpha subunit of GABA receptors due to high levels of allopregnanolone during puberty. Allopregnanolone is a hormone metabolite of progesterone which increases during puberty. I believe that goloxanolone's ability to reverse the effects of allopregnanolone on GABA A receptors makes it a candidate for a new medicine to treat anorexia nervosa. Allopregnanolone is a metabolite of progesterone, which is generally found in higher amounts in adolescent females. This means that the medication may still have different levels of success in men and women battling anorexia. Still, goloxanolone would still target the majority of anorexia nervosa sufferers because most anorexia patients are adolescent young women. Medication goloxanolone would be better than current treatment options because it specifically targets the reuptake ability of the alpha subunit of the GABA receptors. These receptors have shown mutations in anorexia patients, and altering their function has shown increased anxiety levels and decreased food consumptions in experiments with mice. Links to anorexia nervosa and eating disordered tendencies have been discovered, but what is needed next is using these findings and this data for a cure. There is a need for more research into treatment options for anorexia nervosa patients that can help this crippling disease. Studies on various drugs have shown positive results, but they are not always replicable. Past studies have shown the use of the selective serotonin reuptake inhibitor fluoxetine's ability to lessen anxiety in persons with anorexia, yet it has not specifically targeted weight gain. Yet, other studies showed that fluoxetine was successful in increasing food intake in mice, but was not as successful as olanzapine, an antipsychotic drug. Results of a different olanzapine study suggested that the drug may alter the reward system in the brain that gives anorexia patients satisfaction in starving themselves. Still, these results were conflicting, and not every drug or therapy method will work for every patient. Goloxanolone's ability to specifically target the alpha subunit of the GABA receptors and reversing the desensitizing effects of rising levels of allopregnanolone would allow previous research on GABA mutations in anorexia patients to shine, and could further research on this topic, making meaningful progress towards a solution. In an interview with my cousin Meredith, who still suffers from anorexia nervosa, she explained, "People at school would talk about how I lost weight and how I was a lot skinnier, and honestly, it fueled my drive to stop eating. Everyone thought I looked so good, and I loved the positive attention that my body was getting because I had never received compliments like that before. The pictures of women whose ribs are popping out and look so fragile are true stories and do happen, but that's not always the case. In my experience, I didn't become skin and bones as people expected. I just became skinnier than most people. When you're anorexic and become skinny, you're treated more like a success story instead of somebody who is suffering and needs help before they die." This idealization of thinness that Meredith explained is driving people to disordered eating, a vicious cycle they cannot get out of because of their genes. She wants people to know that they should not assume that somebody has an eating disorder just because they aren't deathly skinny or in a hospital bed. Anorexia nervosa is a disease that kills. My solution should be funded for $100 million because negative thoughts about eating and body image are killing our society, one eating disorder at a time.